To start off our conversation today, it all starts with asking the right questions.
I'm really glad to be here today. Thanks, Brett, and thanks, Bill, and your teams for pulling this together. Yes, we're going to talk about asking the right research question, but I'm going to also put you to work. That's the purpose of our session today. It's really directed at practitioners in the room, practitioners online, and my presentation can be shared with everybody, so that's fine. Next slide, please, Neil. Okay, QR code, use your phone. This is where I'm putting you all to work. Even if you're not a practitioner, you can still go to work. I'd like you to type in one question, share a research question or questions which you would like research to answer. Take a few minutes. Is everybody in the Google form? Okay, yep, I'm seeing them. Neil, maybe you could pull up the Google form and we could start looking at what people are putting in there. It'll be on like a different window, right? I can just read some of them. What makes someone violent? Can targeted violence be prevented? How widespread is awareness about referral options? Which referral options are most effective in threat assessment? How can we improve the client referral process? Is annual suicide prevention training effective at reducing suicide rates? There's a lot of good questions here. When to use what types of interventions? How can we improve the client referral process? What impact do clergy have? And how can we improve their effectiveness? What's the best method to prevent violence? How should clinicians get involved in threat assessment? How can we rehabilitate families of persons with targeted violence? How can we engage youth as effective bystanders? There's really a good range of questions here. You're not able to pull it up, Neil? You'd have to get out. All right. Well, and I'll share the list of questions with everybody later. But what encourages me when I look at this, I'm having even more troubles than Bill because this is bigger than a phone. No, that's exercise 4. It should be on exercise 1, which was the other link. Yeah, there we go. But what encourages me is that they're not just questions about the impact of interventions. A lot of the questions begin with the word how. How is really important because how gets at context, mechanisms, processes. A lot of times the questions that people first ask are just like, does this work? And does this reduce violence? And that's, of course, a very important question, but it's sometimes the hardest question to answer. And so we want to have a range of different questions. And that's really the purpose of this meeting today, this session today, is to give you some guidance on different kinds of questions that you should be thinking about in terms of your programs. So, well, I'm not going to try to bring, let's not try to bring that up now, Neil, but maybe you can when it gets to exercise 4 at the end. Maybe we can come to it. We'll have another chance to do that. And I'll share the list of the questions, which looked awesome. But a literary quote from Thomas Pynchon, you know, if they can get you asking the wrong questions, they don't have to worry about the answers. Good quote. But our purpose is to do the opposite, to get you thinking about the right questions so that you have the right answers. It's so important in doing research. Next slide, please. The way I think of it, the research question drives everything. The research question drives who you're going to study, what's the design of the study, what kind of measures you're going to use, how you're going to collect data, and what's the timing. Is it longitudinal? Is it cross-sectional? And so you really have to think carefully about the question, as opposed to saying, like, we have this measure, we have these people, let's give these people this measure, and that's our research. That usually doesn't work out too well. So having a real smart question is important. Next slide, please. So the how, not just the why or to what end. That's why I was really pleased to see how many of those questions began with how. To what end is like the impact question. Did this intervention work? Why is like a rationale question, like, why are we doing this? Or why should we be doing this? But the how is how in the real world complex situation where we do our work in schools and communities and health centers and VAs, how can we make these things effective? Next slide, please. So people have said that good research questions should be specific, measurable, attainable, relevant, time-based. A lot of the questions that I saw were very general, like, does violence prevention work? You couldn't do a project on does violence prevention work? You'd have to drill down many more levels. Does this particular form of violence prevention work in this particular population from time A to time B in changing this particular outcome? So that's what we mean by specificity. Measurable means, yeah, are the outcomes measurable? If we're talking about quantitative research, and that's one of the things we're talking about, but qualitative is, of course, also valuable and not measurable. So can you count it? And can you use statistical methodologies to show whether or not there's a significant difference? Is it attainable? That means, like, is it feasible? In the real world, can we actually do this stuff? Can we collect this data? Can we get people to cooperate? Do we have the money? Do we have the permissions? Do we have the acceptance to do this project? Relevant means, you know, is this getting at important, pertinent questions? If I answer this research question, is it going to move the dial in the field? Is it going to advance our knowledge in a way that improves practice or program? And time-based means that we have to think about, you know, a specific time frame for our work. Some of our studies are just one point in time, and some of our studies are longitudinal, where we follow people over time. And you have to really think about that. Okay, next. So this shows how complicated a lot of our work is. This is a logic model from the Cure Violence project. And you could see there that there are kind of like, well, the first thing you see, there's many boxes and many arrows, which is to say it's a complex intervention, right? There's many moving parts. There's not just like one thing that changes. And I think this is true in a lot of violence prevention work. You can also see that there's kind of two tiers here. There's an individual level behavior tier. You're looking to change some aspects of individuals through your intervention, but there's also a community norms level. And so you would have to each of those different levels have different activities, different processes, different outcomes. So if you were doing if you were asking a research question, you would want that research question to be very specific to one of those. I assume that anyone who's funded through CP3 has a logic model, right? Something like this. And so that any question that you're going to ask in the CP3 world should be aligned with your logic model. It's not going to be able to take on the whole logic model, but a part of it. And if you're in a program that doesn't have a logic model, I would really strongly suggest that you work on a logic model, because that will make your research question much better. Okay, next slide. Heidi, Ellis, and I, and our teams at UIC and Boston Children's worked on this logic model, and I'm introducing it to you because we're going to use this in an exercise. So this one you're going to have to pay a little bit of attention to. It's pretty complicated, but in a way I'm going to make it simpler. So this is for the so-called rehabilitation and reintegration of returning family members of foreign fighters who've come to the US, to Canada, and to many other countries like Kazakhstan, Kosovo, and other such places. And in our logic model, we describe that it's not just 2 R's, rehabilitation and reintegration, it's actually 5. There's repatriation and resettlement, reintegration, rehabilitation, and resilience. And these are like 5 big domains, and different stakeholders get involved in the inputs. They are addressing different kinds of issues. For example, reintegration is addressing, like, how do you integrate people back into the economic, social, and civic life of communities? Rehabilitation is not like a general concept of making people better. It's a very specific concept related to supporting disengagement and nonviolent behavior. And we have a list of 19 outcomes. We have a measure that measures those outcomes. Different ones of those outcomes map onto different domains, okay? So, and all of these add up to a life of nonviolence with dignity, safety, well-being, opportunity, and belonging. You might be wondering, why am I showing you this about rehabilitation and reintegration of family members of foreign fighters? Well, we think we did some good work here in unpacking this and making it not too complicated and operationalizable. So any program could say, what are we doing in each of these domains, and what aren't we doing? And also ask research questions. But we're also in the process of adapting this for domestic population, and that'll be coming pretty soon. But now I'm going to ask you to work with it here. So we're going to come in our next exercise in a few minutes. We're going to come back to this. So next slide, please, Neil. You could think that there are 3 different types of evaluations that could inform what kind of research questions you're developing. So one is an impact evaluation, and that's like, did it make a difference? Did it move the needle on my number 1 outcome, which could be engagement in violence or something else? A process evaluation is more, what is this program doing? How is it working? How, and it's asking, like, are things going as we thought they would be going? Are they going differently? And that's for a program that's already up and running. A formative evaluation would be at the very beginning, or maybe even prior to a program, talking with stakeholders and trying to understand, what's going on in this space, and how can we modify things that we want to modify. So when you are formulating questions, you should think, is this a impact, process, or formative evaluation question? And we're going to play with that in a few minutes. Next. So impact, we're going to start with impact evaluation. So a typical impact evaluation research question would ask, did such and such program have a change on such and such outcome for individuals or groups or organizations from time A to time B? So for example, did program beneficiaries change their knowledge, attitude, behavior, or condition after the program completion? Did all types of program beneficiaries benefit from the program or only specific subgroups? Next question, or next slide. Here's some more examples. Did program participants increase their understanding of preventing violent extremism after completion? Did program participants feel more confident in the self-management of their extremism after program completion? Did program participants improve their social support from non-extremists after program completion? These are examples. Is this clear? Okay, we'll see. Next question, or next slide. Here you go again. Here's this slide. I'm gonna come back to that in a second, but that's what I'm gonna ask you to work with. I'm gonna ask you to develop, I'm gonna ask each table and each breakout group online to spend no more than 5 minutes and come up with at least one good impact question that could come from any part of this model. Okay. Again, we're talking about mothers and children who have returned. You have to be there. Mothers and children who have returned, say from a zone of conflict, and they have disengaged from violent extremism. Here they are in your country, in your community, and you're trying to help them to restart their lives. Kids going to school, moms getting jobs, reunification with family, getting services, that kind of stuff. Okay. So it's kind of, it's not exactly tertiary prevention, but in some ways it's like tertiary prevention. In other ways, it's primary and secondary. It's a complicated mix. Next slide, please. So using the 5R logic model, give an example of a SMART, means whatever SMART stood for: specific, measurable, attainable, relevant, time sensitive, impact research question. Okay. Next slide. Okay, there you go. Take a few minutes now. This is where you're going to have to work with the people at your table, talk to each other, get to know each other if you don't know each other, and people online or in breakout groups. And then we'll ask some of you to share in a few minutes what you came up with. Remember, impact research question. What?
I can't share. My view is the same here that they have, so I don't have to work. So instead, do what you just did, and you start reading them aloud. I will be on the presentation. Okay. But you can have them. You have them on your phone. I have to wait for everyone to do, but I can't when I open it. This is all that comes up. So I can't see who's. If you have admin view, I don't.
Oh, so do you want me to give you my computer, or do you want? Okay. Okay. And then, Does any table have a question yet? Like, have you come up with a question? Did you come up with one? You did? Yeah, okay. Tell us what your question is.
Six, three and,
Okay,
okay, question
go for it.
is to be specific and smart. What is the best school slash childcare setup for children ages 3 to 6 to be reintegrated into their new home communities?
See, I would say, all right, I would say that's a good purpose. That's kind of like the purpose of your research. But the question is that an answerable research question? In the world of research where I'm from, you don't ask what is the best. You ask, is option A or option B or option C better? You have to compare those. So if you made that modification, yes, but then you would also say, when you say the best, you'd say, you're kind of getting at the question of what's the outcome. You got to commit yourself to an outcome. So like when we do mental health interventions, for example, we might choose as our outcome, does it decrease depression? We can't just say, does it improve mental health? We have to say, we have to commit ourselves to one or maybe two primary outcomes. So in this case, integration also is it's like, how do you measure that? How do you measure integration? Tough. Kind of like, what it looks like, but what would you boil that down to? Would that be well-being? Would it be their rating, the kids' rating of feeling good and safe? Would it be the parents' rating? Would it be their participation in school or something? So, I guess all of these things kind of have to be brought down to a level of specificity and measurability. And that's the challenge. But very good start. Let's hear another one.
Our table came up with, did program beneficiaries report an increase in employment opportunities after program completion?
In what kind of opportunity? Economic?
Employment.
Employment. Good. Yeah, I like that question. Thank you. And that's a key outcome. That's one of the key outcomes in these countries, indeed. That's obviously for the adults, not the kids. Yes.
Hello. Did teaching daily living skills improve the mother's level or feelings of belongingness? And we also have a little bit more specific question related to that, but pre and post measures would be necessary for that.
Could you just read it one more time?
Sure. Did teaching, excuse me, did teaching daily living skills improve the mother's level or feelings of belongingness?
I think that's good. You'd get into the question of how do you rate the mother's sense of belongingness? And I also note that, like both of those questions, the last two questions, your outcome was the beneficiary's perception of change, right? Their subjective perception of change. And listening to that, the thought I'm having is, should the outcome be their subjective perception of change, or should it be some objective correlative change? Like, for example, does she have a job and how much money is she making? And in your case, there could be, what could be an objective measure of, what was it, her relatedness or interaction? I mean, how many, there are ways to make that concrete, how many friends do you have who you could call if you needed help with your kid or something? So sometimes, a lot of times in research, we're looking for both an objective, like externally verifiable, objective outcome, and also a subjective perception outcome. We don't necessarily want to just have one. We'll take one more. But these are, I think you all are getting it in terms of impact questions.
So I have the mic. Sorry, over here.
Wait, oh, there you are.
Hi.
Okay.
So we were focused on rehabilitation of youth, and we came up with, did the program show a drop in levels of aggression amongst children over the 6-month intervention program compared to a control group?
Okay. So, that's good. The depression outcome is concrete. The time outcome you specified. I'm thinking of the word program when you said did program. So what does program mean? Does that mean everybody in the program gets the same thing, or is there a specific depression intervention that some of the people in the program are getting? So and probably you meant the second without, but your question was framed generically, but probably you'd want to really specify, did people who got this, I don't know, 10-session meeting with the social worker have decrease in depression? In a lot of the programs that we do in this field, the first challenge is, did they get it? Did they show up? Did they participate? And, were they engaged? And we want to know that, because that's what we think is the change agent. There are a lot of people who are maybe in our programs kind of passively or even showing opposition. And we want to have some way of marking that as well. So, okay. But these are good impact questions. So I think you got it. So let's move on. Process evaluation. So who, what, or where is the program model component for what? Okay. How is the program being implemented? How do program beneficiaries describe their program experiences? What resources are being described as needed for implementing the program? How does the context impact program implementation? So these questions are not asking like, did it make a difference? They're asking, how is it working, right? How is this program being delivered? And from the practitioner side, from the beneficiary side, from other stakeholder side, does it make sense? Is it working the way you thought it was going to work, or are we learning other things here that should be captured? I think this is so important because, in my opinion, our field is much more at this stage than it is the impact stage. And I think a lot of practitioners don't think about doing process evaluation type questions naturally. And I would like you to really plant this in your mind as something that is legitimate, and really needed at this stage of our field, where we face so many implementation challenges. Like Bill, you said, you were talking about behavioral threat assessment and management teams. I mean, I'm in Illinois. It's the government mandates that every school, every K through 12 school has to have those teams. Looks good on paper. What's actually happening in the real world of those schools? How are they able to put those teams together? Do they even have a mental health professional? Have they had the requisite training? Do they know what they're doing? And these are process evaluation type questions. Before we ask, is it working? We have to know how are these things functioning in the school. And we face a lot of implementation challenges in our field. So I think that this is a really high priority area. So next slide, please. Here's just some more examples. Our staff implementing the program in the same time frame to the same intended target population. What variations in implementation occur by site? And are these variations likely to affect program outcomes? So for example, the schools in Joliet are doing it one way. The schools in DuPage are doing it a completely different way. They have innovated it in ways to fit their context, but is that a good thing? Is that not a good thing? That's what a process evaluation is trying to understand. How do beneficiaries describe their program experience? Are there unintended consequences to program participation, either good or bad? What resources are needed? And what recommendations does staff have for future implementation and for sustainability? So these are all good questions for process evaluations. Next slide. So I'm going to put you to work one more time. Using the same 5R logic model, I want you to think now about process questions. So go back to the 5R, the next slide, we'll show you that. I would like you all to work together for a few minutes and come up with at least one good process question. Okay?
We're online.
Time is moving on, so I want to move us ahead. So who's got a process question to share? And Neil, I don't know if there's a way to access anybody on the internet. who could maybe put it in a chat or something and you could read it.
I'm monitoring the chat.
Okay. Yeah, if you're on the internet, put your process question in the chat. Go for it.
Okay, our question is, do implementing staff members have the cultural and linguistic skills and competencies to work with the target population?
So that's really good. That's getting at a critical issue. But I'll note that you framed it as a closed-ended question. Do they have? In a process evaluation, we're probably more likely to frame it as a how, like how are the staff doing in terms of functioning with the necessary linguistic and cultural understandings. So it's more open-ended, and it would get at it would allow you to get at issues of, like, do they have that capacity innately? Are they getting the training that they need? Maybe they're strong in some areas, but not so strong in other areas. So it's not a simple yes, no question. So keep it open-ended. Okay, good, but very good. Where's the,
Yeah.
okay, go for it.
In terms of reintegration, do program participants perceive a higher level of support from social workers or peer supporters on the multidisciplinary team?
I've been to too many Bruce Springsteen concerts, especially in the past year, Bill. But I didn't quite get all the words. Could you really say it loud? Put the mic closer to you.
Okay, better?
Yes.
In terms of reintegration, do program participants perceive a higher level of support from social workers or peer supporters on the multidisciplinary team?
Do they receive a higher level of support?
So do they think, like, where do they perceive getting a higher level of support? So it's subjective.
Hard for me to work with that one. I think you're in the right direction, but again, I might, in a way, you did like the first person, you framed it as a closed-ended question. Turn it more into a process question. Asking how can you start it with, instead of did they, how? And that will often change the whole construction of the question. Okay, one more, then I'm going to have to move on.
So which wasn't in your who, what, when, where, how, but I have which core component of our model produced the most significant increase in non-aggressive behavior?
So I hear that as an impact question. Could you turn it into a process question? You could ask, for example, you could ask program beneficiaries or practitioners, what do the practitioners believe was the most impactful component of the program? Or what do the program recipients believe? And we often ask that in this, and we also ask, what is the program not doing explicitly that they could be doing that would be helpful to lead to non-aggression? So we made the switch from did it change things to the perception of the players in the program? Then it's a process question. Okay, we could go on for a long time, but I see Brett telling us to move on. Let's go to the next slide. So we did impact and process. I'm just going to spend a very short amount of time on a few other lenses for thinking about questions, and then we'll wrap it up. So one is formative. So formative is again done at the beginning of a program, like when it's just started or before it started. And these are some of the kinds of questions you would ask, and I'm not going to read all of these, but again, how does stakeholders, like, what do they think is important in this program? Challenges and barriers to implementation. That's always good to ask about. How well is the team functioning together? Who's trying to implement this? Those kinds of things. So you can look at these later. Let's go on to the next one. David Eisenman and I made a whole report on formative evaluation based upon our work in LA some years ago. And we outlined the steps of a formative evaluation, and there's a report on that I could send to you, but these were the steps that you engage in. And it's very doable for practitioners. And again, like, this is where our field is at. And so don't shortchange these kinds of evaluations and these kinds of questions. Next. So when we think about the life cycle of a program, starting a program, middle, and, you know, the impact evaluation is really when you're kind of down the line and you have a program that you're feeling pretty good about. But earlier in the program, you want to do, again, formative evaluation and process evaluation. So ask those questions again to improve the quality of the program and to describe how the program is working so that you can share that with other folks in the field. Next. I'm going to explain implementation research in 2 quick slides. So back to our school example, behavioral threat assessment and management in schools. Let's think that there's a box down there that says clinical intervention. That's threat assessment and management. So let's say we have these teams, we have this evidence, well, it's a best practice strategy that's supposed to appropriately assess and refer or deal with persons with violence. And so that's your intervention. And we want to know, does that work? But there's another level, and the implementation level is, how do we get schools to do this? How do we stand up those teams? How do we make those teams work together? How do we train and support those people? That's the implementation dimension. So there's really 2 interventions. There's an intervention of the BTAM program itself with kids run by teachers and other school staff. But then there's an intervention at a higher level, say done by the state or the school board or whatever entity is trying to teach all of those schools how to do this. So so some of your questions can be at that implementation level, which is asking about those strategies. So next slide. So are we doing the right interventions? Have we adapted them as needed? So am I, for example, trying to get schools to do something that's just not doable? It just doesn't fit the capacities of schools. It hasn't been appropriately adapted. Maybe it worked well, for example, in a corporate workplace setting, but it's not going to work as well in a K through 12 school. Are our implementation strategies the right ones? You know, that could be, should we be sending teams to every school, or should we be sending teams to every school district, or should we be doing it online? There are many different ways to approach the dissemination, the teaching and training of that. And so we could ask questions about, are those strategies the right strategies? And then, of course, are they delivering the intervention as planned? Are they adapting it? And And variability, heterogeneity is a big issue in implementation. Let's just say you're all different schools and you all end up, the people on this side of the room end up implementing it one way. The people here end up implementing it another way. Well, let's learn from that. Maybe you've adapted it in some ways that are really helpful and went beyond the intention of the program, but really enhanced the program. But maybe you have, on this side, have cut something out that was a core element that needs to be there. And without that, it's not functioning. So we should be agnostic about these kinds of innovations. Some of them are good, some of them aren't, but we can ask about it in research questions, okay? So I'm just trying to plant in your head, think about asking implementation questions. And then I think I have two more things. A lot of us are doing piloting of interventions. Like we're doing something for the very first time, right? And when we do something for the first time, we usually don't ask, is it working? Like, did it work? Did it change things? We usually ask questions about feasibility, acceptability, and change experiences. So feasibility is essentially, can it work? You know, like using my example again, can a BTAM be implemented in a public school? Or you can pick the other examples from your work. Can we deliver this suicide prevention intervention in a faith-based setting? Like, will people show up? Can practitioners be trained? All that stuff. Intervention acceptability. How did the intervention meet or fail to meet your expectations and needs? That's a question you would ask to the beneficiaries, to the practitioners. And change experiences. What, if any, changes did the intervention make for you? Either as practitioners or as beneficiaries. So these are perfectly good kinds of questions to ask in a pilot experience. Okay, lastly, back to the public health approach. You can ask questions which are focused on different aspects of primary, secondary, or tertiary prevention. You wouldn't ask the same question across all three of those levels, right? Because primary prevention is concerned with population level changes, tertiary prevention with individuals who've, you know, done something or been convicted of something. So it's a different socioecological levels, different kinds of goals, different kinds of change mechanisms. So you should think about which question, is this a primary, secondary, tertiary question? Okay, next slide. Last thing, and we're done. I would like you to all go to this one. And now, having done what we did, put in another research question that you didn't do before. And I'm asking you to specifically ask either a formative or a process or piloting or implementation or public health prevention research question. And then we're done. How do we know? Has anybody hit submit yet? Because I'm not seeing them. This could be about any program anywhere. Just try to ask one of those kinds of questions. These are really good. I'm seeing a lot of process and piloting questions. Like, how have BTAMs been implemented in different states and municipalities? How are government and NGOs identifying and referring clients to the program? How do undergraduate students who work on the project as assistants experience the work and drive change forward? Why not? How accessible was the public health training for program participants? What did students feel was the most impactful portion of the training? How does small group dialogue and discussion about media affect people's media literacy knowledge and skills in ways that increase active listening, exposure to propaganda, intellectual humility, and defensiveness from time 1 to time 2? Whoa, that's a good question. How can we provide better guidance for intervention practitioners who use multiple assessment tools to assess violence risk? How can we ensure that tools are complementary towards better holistic assessment and case management? That's like a purpose question. The process question would be, how are the practitioners utilizing the tools that they have, and are they supportive of or aligned with their practice mission, or in some ways not? So you have to, that's about making a question answerable as opposed to stating like the purpose of the research. Well, I think these are really good. So I think we should wrap it up, but what I'm going to do is I'm going to share with Neil the results from the first round of questions, exercise 1 and exercise 4. And I believe what you'll see is that the questions are started off pretty good, but got even better because people were trying out different of these areas. And so I hope this has been helpful, and I hope you continue to work with this. Thank you.